So every drug has a 3 names. Okay, what are the 3 names? First is chemical name, generic name or non-proprietary name, and another one is proprietary name or the brand name, isn't it? Okay, so I have shown you the picture of the strips. Okay, in the strips, what are the things you will be seeing, looking for when you see a strip of medicine? First is dosage form. Dosage form in which form? Okay, then okay, quantity of tablets, then okay, then composition, or the composition will be in what, which name? Huh? Which name will be present in the composition? No, it will be generic name. Okay, why we don't use the chemical name? Complex hota hai, difficult hota hai. Okay, that is the reason. Okay, and other than that, anything more? Batch number or huh? Worldwide same means no. Batch number and license number. Okay, anything more? We have to also see how you have to take the drug. Okay, it is also written there. Okay, okay, okay. Then today we will be taking the class on dosage form. Okay, so what are the form of dosage? You know, huh? If you divide it into various forms, what are the forms? Do you know? You have come through? Huh? Oral. Okay. In orally, how many types are there? Solid and liquid. Okay. In solid and in solid, what you can take? What type of medicines? Tablets. Then. Okay. So there are various form. If you particularly go into the oral route and into tablets. Okay, there are various types of tablets. Okay, so let us go into that. Okay, one by one. Okay, so let me show you the picture. Okay, so if we divide the drugs in this dosage form. Okay, so first orally. So see how many types are there: powders, tablets, capsules, suspension, solution, emulsion. Okay, there are many. Okay, and list. Okay, some are parenteral. Okay, some are transdermal, some are intraocular. Okay, then sublingual. Okay, then vaginal, conjunctival. Okay, intranasal, rectal also. Okay, interrespiratory, urethral. Okay, so we'll be going into that. Okay, so this is going to be a bit a long class. Okay, so bear with me. Okay, so first let us go into some terminologies. Okay, before going into that, because you won't be understanding without knowing these terminologies. Okay, so what does a dose mean? What do you mean by dose? Okay, let us see. Okay, what is that? It is the quantity of the drug which produces desired therapeutic response in a recipient. And formulation, it is the recipe by which a drug is prepared. Okay, in the dose it contains drugs. Okay, then excipients, vehicles, flavoring agents and preservatives. So other than the drug, in the dose there are many things. Okay, added. Okay, such as excipients. What is excipients? Do you know? Okay, so excipients are pharmacologically inert substances that are added to the pharmaceutical preparation when a small quantity of drug is present to add bulk and give appearance to the tablet. Okay, they are also used to mask the unpleasant taste. Okay, so these excipients are the pharmacological inert substances, okay, which give form and shape to the tablet. Okay, and also it marks the unpleasant taste of the drug. Okay, and what is vehicles? So vehicles, these are added in pharmaceutical preparation to dissolve or suspend the drug, okay, for to make them better application and more palatable. Okay, these are sugars, syrups. Okay, then lubricants, it helps to keep the tablet in from sticking to the manufacturing machine. Okay, then coloring agents. Okay, these are harmless substances which used for imparting color to a dosage form. Okay, then flavoring agents are also there. Okay, different flavoring agents are used to mask the nauseating and unpleasant taste of the medicine. Then sweetening agents are also there. Okay, different sweetening agents like sucrose are used to mask the bad taste of the syrup and elixirs. So these are the different things and preservatives which are added other than the drug. Okay, so what about tablets? What do you mean by a tablet? Can you tell? Okay, solid form of drug. Okay, so these contain unit dose of one or more powdered or granulated drugs that are prepared by compressing under heavy pressure, okay, into round or disc shaped, suitable for swallowing. Okay, this can be triangular or cylindrical also. So what are the different types of tablets? Okay, let us see. There are uncoated tablets. Okay, those are not coated. Okay, tablets like this. Okay, can you see this one? The first one, can you see this one? These are the uncoated tablets. Okay, there is no coating in it. Okay, then there are coated tablets which contain one or more layers. Okay, then there are sugar coated tablets, film coated tablets. Okay, one important type of tablet is enteric-coated tablets. Okay, these are delayed release tablets. Okay, these can be single or multi-layered coating intended to resist digestion by gastric acid but get disintegrated in the alkaline medium of the intestine. So this type of medicine or tablets, they resist the digestion of the gastric juice, and after going into the intestine, then only it gets disintegrated. Okay, it gets dissolved. Okay, so one precaution you must take when you take this type of tablet is it should be taken in unbroken form. Okay, you shouldn't break it. You shouldn't break when you're taking it. Okay, so what is the disadvantage? It is a gastric irritant also. Okay, so if it breaks, it can increase the gastric juice. Okay, sometimes if you take it for a long period of time, it might cause ulcerations. Okay, have you heard the term NSAIDs? So those type of drugs are enteric-coated tablets. Okay, so you should take precaution. You should not break. Okay, when you're taking it. Then sustained release tablets or extended or prolonged releasing tablets. Okay, again this is a special type of tablet. Okay, so let us see. Drug particles are coated with different types of inert resins so that each type of coating dissolves at different time intervals. On administration, initially the drug is released rapidly to provide concentration sufficient to cause desired response, and then sustained release at constant rate is sufficient for maintenance therapy for prolonged period. What did you mean by that? So those type of tablets, okay, have coating, okay, like this. Okay, can you see the coatings? One is insoluble polymer membrane and one is aqueous okay, aqueous solution. Okay, can see, can you see? So when you take the drug, initially the aqueous solution which is present under it, it dissolves, it comes to the drug, and instantly it causes the desired response. Okay, when the desired response is reached, then the insoluble polymer membrane, it starts disintegrating. Okay, slowly by slowly, slowly by slowly. So a sustained release is there at a constant response is, then a constant response is attained. Okay, when it is, the rate is sufficient, okay, for maintaining the therapy for prolonged period. Okay, so this is a special type. Okay, so this type of tablet, how will you identify? Okay, by the brand name, okay, such as diclofenac. Okay, if it is there, the drug is there, then it will be diclofenac SR. Okay, sustained release. Okay, it will be there, so you can identify the tablet like that. So what is the advantage of this drug? These lead to reduced frequency of administration. So if suppose if one type of drug, suppose this diclofenac, okay, this NSAID group of drug should be taken 2 times a day. Okay, 2 times a day, 12 hourly it should be taken. So if you are taking a tablet SR type of tablet, so it will be releasing slowly. Okay, so 1 tablet would be sufficient. Okay, so this leads to reduced frequency of administration and good patient compliance. Okay, but these are more expensive than the other type of tablets. Okay, one of the tablets are SCORED tablets. Okay, have you heard the name SCORED tablets? SCORED, SCORED tablets. Okay, so this type of, so these are SCORED type of tablets. This one. Okay, there is a line in between. Okay, there is a line in between. What is the benefit of this type of tablet? Can you tell? Okay, so suppose his age and weight, he requires, suppose 250 milligram. Okay, I am taking the example of paracetamol. Okay, and you are having tablets, okay, at your home, and he can take orally. Okay, but according to your age and your weight, your dose is around 500 milligram. Okay, so what is the advantage of that? If you break the tablet from the middle according to the line, okay, you can use for the children's also. Okay, it will be around 250 milligram. Okay, so this is the advantage of SCORED tablets. Okay, which is not possible in case of unscored tablets. Okay, then some are dispersible tablets. Okay, you have seen, I think, in the advertisement. Okay, some type of tablets they directly put into the glass of water and they get immediately dissolved. Okay, so those are dispersible tablets. Okay, they are again of 2 types: dispersible and effervescent tablets. Okay, some are chewable tablets. Okay, we directly chew them. Okay, can you tell an example if you know? Huh? Vitamin C. Okay, it comes under Limc brand. Okay, under the name Limc. Okay, anything more? Anything more you know? Some are vitamin D3 also. Okay, in vitamin D3 also there is a form of chewable form. Then K2 tablets. Okay, okay. Then there are sublingual or buccal type of tablets. Okay, so these are small flat oval tablets intended to be inserted in the buccal pouch or beneath the tongue. Okay, where the active ingredients may be directly absorbed through the mucosa into the systemic circulation. Okay, on the mucosa the drug is directly absorbed into the systemic circulation. Can you name any drug? Huh? Nitroglycerin. Okay, so those type of drug are given in MI. Okay, so this is glycerin trinitrate. Okay, GTN and nitrates group of drugs. Okay, those drugs are given like that. Okay, then lozenges or trosses. Okay, again these are type of drugs to produce action locally. Okay, in in coughing we normally give lozenges. Okay, so these are flat, rounded, rectangular preparation kept in mouth until they dissolve. Okay, they temporarily produce high concentration of drug in the oral cavity and are used to treat local conditions of the mouth or the throat. Okay, then some new generation formulas have arrived. Okay, so this group of drug can be either in liquid or in the form of tablet. They are specially designed for dysphasic, geriatric, pediatric, bedridden, traveling, and psychotic patients. Okay, what is the advantage of this group of drug is they disintegrate very fast when placed in the mouth. Okay, you don't need to chew also, you don't need water also for dissolving. Okay, this is the advantage of this new generation group of drug. Okay, drugs like ondansetron and domperidone. Okay, have you heard the name Ondem MD or Zofar MD? Okay, so what does MD mean? Mouth dissolving. So if you directly keep in your mouth, you don't need to chew also, you don't need water also. When you directly keep into your mouth, it directly gets dissolved. Okay, so these are tablets. Now let's go into capsules. Okay, so what are capsules? Capsules are small containers usually made of gelatin. Okay, they may be hard or soft. They are available in different colors and are usually bland to taste. Okay, so can you see this picture? So this is the type of hard capsule. Okay, the picture, the upper one is the type of hard capsule. Okay, so the drug will be in the form of powder in the hard capsule. Okay, it contains two cylindrical sections of shell. Okay, those are joined together. Okay, maybe in the form of powder or granules. Okay, but in case of soft capsule, the drug will be in the liquid form. Okay, then another one is modified release capsules. Okay, again this is a criteria of tablets. Okay, which can be delayed releasing. Okay, this will go slowly. Okay, or sustained release. Okay, so can you name so the next point is on powders. Okay, so can you name any powder form of drug you are taking and everyone has taken? Huh? Inu. Everyone has taken? Huh? First bench? You also have taken? Any other drug? Good example. Okay. ORS. Everyone has taken ORS. So this is a powder form of drug. Any other example? Have you heard the name Glucon-D? So again, this is a form of powder. Okay, so we give the glucose. Okay, in that powder form. Okay. Okay, so orally these are the most commonly taken drugs. Okay, then the next form is suppositories. So what do you mean by suppositories? Have you heard the term suppositories? See, this comes under, what is this? नहीं दिखाई दे रहा है, मुझे तो दिखाई दे रहा है। ये क्या लिखा है? What is this? Rectal. What does this mean? From where does rectal term comes from? And so rectum. Okay, so those type of medicine which are given rectally. Okay, like suppositories, enemas, and ointments. Okay, so these are mixture of drugs with firm base that can be molded in shape suitable for insertion into cavities or orifice. They melt at body temperature. Okay, when you keep it there, from the body temperature it will melt, and the medication will be released when it comes to the contact of the mucosa. Okay, to produce the local effect. Okay, so these suppositories can be rectal, can be vaginal. Okay, can be urethral. Okay. So when do you use for rectal suppositories? Can you tell? You have not faced constipation till adult. See, so उसमें भी देते हैं suppositories, rectal enema भी में भी देते हैं, ठीक है. So when there is an impacted stool, okay, when it cannot, when the person cannot defecate properly, so that time also we give the enema, okay, parectally, okay. And in some cases of radiological examination, okay, उसमें भी हम लोग देते हैं, हाँ, कोरोनोस्कोपी में देते हैं, ठीक है. Then some in what are the use of vaginal suppositories? Can you tell? Vaginal suppositories, infection, in case of fungal infections, okay, in case of bacterial infections we use vaginal suppositories, okay. Then also for urethral also we use, okay, those are pencil shaped, okay, those should be in the form of pencil, okay, and it will be covered in foil paper, okay. Any confusion till this oral oral form and suppositories? Any confusion? Okay. So let us go into the liquid forms, okay. So liquid form are broadly classified into two groups, monophasic and biphasic, okay. Monophasic dose form comprises one phase orable pharmaceutical formulation intended for oral use, okay. Examples are mixtures, linctuses, drafts, elixirs, syrups, drops. So these all are monophasic, okay. They only have one phase, okay. And biphasic liquid dosage form is one which contains two phases. So these contain two phases of preparation, and examples are suspension and emulsions, okay. Suppose in a 100 gram of medicine, okay, if you are taking that medicine, okay, this much percentage, 66.7% of sugar will be present in that, okay, and the rest will be the medicine, okay. What is linctuses? Linctuses are viscous oral liquid containing one or more medicaments solution in a vehicle that usually contain high proportion of sucrose other sugars, okay. So the sugar composition in linctuses is much more than that of the syrup, okay, more than 66.7%, okay, and this is the reason for its viscosity. It will be more viscous, okay, than the syrup. And how you will take it? Linctuses is intended to be sipped slowly in small doses to allow to trickle down the throat in an undiluted form. This gives maximum and prolonged effect of medicaments in the throat, okay. So this is the picture of the syrup, okay, and this is the picture of the linctus, okay. So if you get these two samples, okay, can you identify? So this one, suppose apart from this syrup written on the box, okay, how will you identify? Can you identify? If it is not written there, if you directly see the sample without seeing the name in the type, so what do you mean by viscous? Dense, okay. So when you receive or get this type of samples, okay, always see that the thickness will be much more in case of linctuses, okay, compared to the syrup. And why it is that? Because of the sugar content, okay. Another form is elixir, okay. Elixir are clear flavored sweetened hydroalcohol liquid oral preparation. Okay, compared to syrup, elixirs are usually less sweet and less because they contain less amount of sugar. So which one contains least amount of sugar? Elixirs. Then syrup how much? Okay, so less than 66.7% is the elixir. Okay, then 66.7% is the syrup. Then last one क्या है? हाँ? Linctus. Okay. Then the next one is mixture. Okay. Pharmaceutical mixtures are liquid oral preparation consist of one or more medicaments dissolved, suspended, or diffused in aqueous vehicle. Okay. So this is the example of the elixir. Okay. See what is the drug written there? Can you name? This is the drug, Benjamins. What do you think? This is the brand name. Okay. This is the company which is producing. Okay, and this is the, what is this? Diphenhydramine. Okay, this is the name, okay, of the drug. So this usually we give in allergic conditions, okay, like running nose, okay, and coughing. So this is the example of an elixir. Okay, then this is the example of mixture, kaolin mixture. Okay. Okay, so next is drops. Okay, so it is written pediatric drop, but it is not pediatric drop. Okay, so this is an eye drop, it is written. Okay, this is an ophthalmic preparation. So in ophthalmic preparation, the dose of the drug is same in case of children's and in case of adults. Okay, there is no difference. Okay, so drops are liquid preparations of potent drugs, usually in solution, that are intended to be administered in small volumes. Okay, this is which group? Moxifloxacin. Have you heard the name? Moxifloxacin. This is a type of antibiotic. Okay, antibiotic drug. Okay, comes under the brand name of Mahaflox. Okay, so liquid preparation again can be of biphasic. Okay, biphasic liquid forms. One is suspension and one is emulsion. Okay, so what is suspension? Suspension are biphasic liquid dosage form containing essentially insoluble, finely divided solid particles or drugs suspended with the help of suspending agent in a liquid medium. The solid particles act as dispersed phase, whereas liquid act as a continuous phase. Okay, so what do you mean by dispersed phase and continuous phase? In the next slide we'll see. Okay, so this is an example of suspension. Okay, Cephalexina. Okay, oral suspension. Okay, so the next is emulsion. Okay, an emulsion is a biphasic liquid preparation containing two immiscible liquids, usually oil and water, one of which is dispersed as minute globules into the other and rendered homogeneous by the addition of emulsifying agent. The liquid which is converted into minute globules is called dispersed phase. Okay, and the liquid in which the globules are dispersed is called the continuous phase. Okay, so what do you mean by these two immiscible liquids which cannot be mixed? Okay, such as oil and water. Okay, so here they are saying that there are two phases. One is dispersed phase, where the liquid is converted into minute globules, and when the liquid in which the globules are dispersed, this is known as the continuous phase. Okay, so these emulsions are of two types. When we add oil in water type, okay, this is O by W. Emulsion in which oil is in dispersed phase, where the water is in the continuous phase. Okay, So this minute globules now is the oil here when I am adding oil in water, okay, and when I am adding water in oil, okay, the dispersed phase becomes the, which one is the dispersed phase now? The water, okay, the water is now that in the dispersed phase, but the oil is in the continuous phase, okay. So this is the main reason why they are using this as the liquid when it is converted to minute globules, and when the liquid is added in the globules are added in the liquid, okay. Any confusion here? Why we are referring when we are using oil as that in the dispersed phase, when you are adding in water, and when the water is being added to the in the oil, why the water is being called as the dispersed phase? Any confusion? Dekho, this simple thing, not, don't confuse it, okay. This is a very simple thing. ठीक है. This is albendazole oral emulsion, okay. Example, and nesifine, okay, which is containing magnesium hydroxide, okay. Oral emulsion, and these are suspensions, okay. These all are suspensions. Okay. So what are the function of these excipients? I have told you, na, what does it do in the first slide when I was saying what does the excipients do? It gives the shape and form, and also it marks the taste of the drug, isn't it? So other than that, what does it do? It imparts weight, accuracy, volume, okay, improves solubility, increase stability, enhance bioavailability, modify the drug release, okay. So these are the various functions other than that, okay. Some are coloring agents, okay. What are the use of this? You just need to know, okay. Like masking of the color drugs, product identification, identify more elegant product, okay. So these are the few things, okay. And these coloring agents which are there in the slide, these are all FDA approved, okay. Okay, so these all were the oral, okay, oral form, okay. Then the next comes the drugs which can be taken or given by transcutaneous routes, okay. What do you mean by transcutaneous? Subcut, 45°. Transcutaneous, what do you mean by the word trans and cutaneous? Through the skin, okay, through the skin, okay. What are the layers of the skin, can you tell? So which dermis, epidermis is there, na? What are the first one? So stratum corneum, okay, through the stratum corneum it gets in, okay. So what do you mean by the term inunction? So inunction in angina, okay, the drugs like nitroglycerin we give through the transcutaneous routes, okay. There are patches, okay, I will show you the picture, okay. There are patches, okay, we give in those type of category of patients, okay. Then iontophoresis, galvanic current is for penetration of drugs deeper tissue. So we use galvanic current in small voltage, okay. The drugs are given through the anode and cathode, okay. Drugs like salicylates, okay. These group of drugs are given directly through the current, okay, into the body, into deeper structures, okay. Then there are jet injections, okay, painless injection high velocity jet produced through a microfine orifice. Okay. So here we don't use a syringe. Okay. Directly by the pressure, okay, of the drug, we directly put the drug inside the skin. Okay. And transdermal therapeutic system. Okay, this is the novel drug delivery system. Okay, examples are GTN, nicotine, estradiol, scopolamine patch. Okay, so these groups of drug, okay, are given transdermally. Okay, I will show you the picture in the next slide. Then some are implants. Have you heard the term implants? So some group of drugs are given through implants. Implants means above the skin also, below the skin also. Okay, so those category of drugs are given through implants. Okay, examples are norplans. Okay, these are biodegradable and non-biodegradable drugs. Okay, so let us see about this therapeutic system. Okay, this can be given in the exam. Okay, so understand this nicely. Okay, so these are devices in the form of adhesive patches of various shapes and size, okay, which deliver the contained drug at a constant rate into systemic circulation by a stratum corneum. Drug bound to a polymer held in a reservoir between an occlusive backing film at a rate controlling micropore membrane. Okay, so these contain adhesives, okay, which is directly attached with the skin, and from the skin at a constant rate the drug goes inside the from the skin inside the deeper structures. Okay. Okay, so this rate is controlled by this micropore membrane. Okay, so a form of cutaneous drug administration, highly lipid soluble drugs can be applied over the skin for slow and prolonged absorption. The liver bypass, increased viability, regulated absorption can be achieved. Suppose you are having a pain, okay, in this deltoid. Okay, so what do you think? Which type of drug? This is not a diagnosing. This is related about the drugs. Okay. Okay. So what do you think? Which type of drug should be given? Huh? Injection. Pain में pain दोगे? No, I am saying if you are having pain in your deltoid, suppose. Okay. So what type of drug and in which form should be given to be relieved? Oral means faster action, na? You need faster relief from this pain. So if you are giving orally, it will be taking more time, na? Tablet will go inside, it will get dissolved, okay, and it will come to the blood. Then there will be the effect. Okay. Then what do you think? Huh? I'm not hearing. Spray or gel. Yeah, you are saying directly, na? Local response you want, so you want locally a drug to be acting. Okay, so this is the importance of this transdermal patch. Okay, let us see the structure of the patch. Okay, so it is having a backing film which is impermeable. Okay, this is impermeable, and here the drug is present, and these are the micropores, okay, through which the drug comes, okay, out, and this is the adhesive. Okay, this is the adhesive layer, okay, through which the adhesion, okay, the patch is attached with the skin, okay, and from there the drug reaches downwards, okay, and it achieves the local response. Okay, any confusion regarding this structure, this one or this one? Same, this is the same. Have you seen this type of patch? I think in sports, okay, those who play sports, okay, and in those like cricketers or footballers, they use it, okay, like they are having pain, okay, suppose in the muscle this group of muscle, quadriceps femoris, okay, or biceps, okay, and in badminton also, I think if you follow, uh-huh, patches are there, okay, so why they are using this? That is the reason, okay, to achieve local response more faster, okay, at a constant rate, okay. Okay, so what are the sites we use, okay? So we can use in chest, we can use in abdomen, upper arm, lower back, buttocks, mastoid region, okay, and the highly soluble drugs are GTN, fentanyl, nicotine, estradiol, scopolamine. Okay. So what is the advantage of these? These are easy to apply, regulated dose, and quick drug response. Okay. But the disadvantage is it is costly, okay, selective and local administered. Okay. So in cases of angina pectoralis, okay, we'll be coming into that, okay. Angina pectoralis, then in cases of MI, myocardial infarction, okay. So this GTN also can be given in those type of drugs, okay, if we apply directly into the chest, okay. And how to apply, okay, let's see the application, okay. So remove the liner covering the sticky side of the skin patch, then press the patch firmly in place using the palm of your hand for a minimum of 30 seconds, okay. So after removing the sticky side, okay, of the this adhesive patch, okay, then a minimum of 30 seconds has to be pressed, okay, pressurized in that area, and we have to make sure that the edges are fixed, okay, it shouldn't be loose, and if it is loose, then we need to add tapes, okay, first aid tapes to fix it properly, okay, then only we can have the response, okay. Any confusion how to apply? Okay, so these are the sites, okay. This is the patch, okay. You have to remove it, and then we have to attach it, and then we have to see the edges are not loose, okay, it is fixed, and then we have to press it, okay. So any confusion regarding this transdermal patch? This one, okay, this is the cap, not mouthpiece. Yeah. So this is the cap, and this is the canister, okay. You need to press there, okay. I will show you. So this is the canister, this is the boot, and this is the dosing chamber, okay. From there the drug comes out, and this is the mouthpiece which we need to attach, okay, when we are taking the medicine. Okay, so how we need to use it, okay. So first we need to remove the cap, okay. Before that we need to wash our hand, okay. It's given nicely in this picture. First we need to wash our hand with soap and water, then we have to remove the cap, hold the inhaler upright position, then we need to shake it, okay. Then first we need to spray once in the air, okay. Then we need to attach the mouthpiece to our mouth, okay. How do we remember during our respiratory classes, spirometry, how do we need to fix this mouthpiece? Can you tell? Huh? कुछ याद नहीं है? I'm not on the shaking. How do you need to attach mouthpiece? कैसे? When you have checked na your lung capacities, कैसे? How we have said? How should you hold? कैसे? बताओ. I need to know. Yeah, we have to sterilize the mouthpiece. Then we need to hold the mouthpiece with our teeth. Then we need to close. How? Close the cavity with the help of our lips properly. Then we need to breathe in, isn't it? So after putting, okay, before putting this in the mouth, you need to breathe out first. Okay, breathe out first. Then without chamber, there is a difference with the chamber and without the chamber. So without the chamber, this is without the chamber MDI. So here, when you are just pressing it, at that very moment you have to take a deep breath. Okay, but in case of the chamber, when you are pressing it, pressing the canister, you can hold or you can delay for few seconds, then you can take it in. Okay, your first breath. Okay, so this is the main difference between this without a chamber and with the chamber. Okay, MDI. So then, at what rate you will be taking it in? It shouldn't be too fast or too slow. Okay, usually 5 seconds. Okay, 5 seconds speed you have to take it in. Okay, then you have to hold for 10 seconds. 10 seconds you have to hold. Okay, then you can release the drug or the breath. Okay, from your mouth. Usually it is the nose is preferred. Okay, you can release the from it the nose. Then if you are supposed to take 2 puffs, okay, you should wait for at least 1 minute. Understood? Any confusion? Okay, so the same thing is written here. Okay, I am not going into it. Okay, one thing is there. Okay, if you are taking a steroid, okay, another step should be added. Another step should be added at the last. What is that? You need to wash your mouth. You need to gargle. Okay, why?
Any germs or bacteria.
Why? So there is a high chance, okay, if you are taking repeated and you are not doing the last step, okay, if you are taking corticosteroid, there is a high chance of getting fungal infection, okay, in the throat, okay, or hoarseness, okay. So these are the 2 things you need to keep in mind, okay. So the common problems, okay, what are the common problems we can have? Like holding the inhaler in wrong position, like this, okay, like this, okay, it should be like this, okay. Okay, not breathing in the same time as pressing the canister, okay, for this without the chamber, okay, remember, not breathing in deeply enough, okay, not holding the breath for long enough, several puffs without waiting or shaking the inhaler in between, okay. This will be aerosol form, okay. In case of MDI, it is in the form of aerosol. Okay, one form is rota cap. Okay, in there it is in the form of powder form. Okay, this is in the form of aerosol. Okay, fine mist. Okay, it will be released in the form of fine mist. Okay. Okay, so what? Same thing. Okay. In case of chamber, the only advantage is that you can take the drug. Okay. There can be a delay for few seconds. Okay, instantly it is not necessary to take the drug. Okay, and one more thing is that in case of this what to say, without chamber MDI, the drug is present more in the pharyngeal area. Okay, it is attached. Okay, and the benefit of the without the with the chamber is the more drug is reaching the lungs, okay, in case of that, and there is less wastage of drug, okay. So here see some spaces have valve, okay. The valve is important to keep the medicine from escaping the holding chamber. With the correct use of the spacer, the amount of medicine that can get into the lungs can be as much as 25%, okay. Okay, so these are the priming, okay. Before starting it, what are the things you need to make ensure? So you have to remove the cap, okay, shake it. Same thing, you have to spray it in the air, okay. The number of spare needed to prime your MDI will depend on the type of medication. Okay, same thing. If you can use a spacer chamber each time you use your MDI, use a spacer when using a MDI is helpful. Okay, these are the things. Okay, one more thing is that when you're using, okay, one technology I think has been given inside it. Okay, so that the person who is using the drug can identify whether he is taking it properly or not. Okay, suppose you are taking it too fast or too slow. Okay, one horn like sound is there. Okay, in the first slide I think it is there. So a horn like sound will be there. Okay, if you are not taking it properly. Okay, so with this a person can know that he is having difficulty in taking or he is doing any mistake. Okay, from this what are the aims and objectives? Okay, you should know. So first of all you need to identify the dosage form. Okay, then state the nomenclature, then its clinical uses. Okay, then when you are prescribing a drug to a patient, what are the things you need to know and you need to tell the patient. Okay, a stepwise communication of your patient on how to use this drug under following. Okay, Martindale drug compendia. Okay, what is that? This is first the strength of the drug. Okay, dose for adult. If the patient is an adult, okay, you need to tell how much dose you are giving. If child, then how much. Okay, then precautions. Okay, when you are prescribing the drug, what are the precautions the person need to take before taking the drug? Okay, and the side effects. All these things you have to explain it to the patient. Okay, before giving the drug. Okay. Okay, so any confusion regarding this class? Anything? Okay.